welcome and some webinar housekeeping, particularly for those of you who might not be familiar with Google Hangouts. And then I'm going to be passing over to the panel. So I'll just introduce who the panel will be for today. It's going to be Tim Horton will kick off, and he's the Chief Executive of Community First. Then I'll be handing over to Tim Cooling, who's the Head of Strategy for Hampshire and the Isle of Wight Partnership of Clinical Commissioning Groups. And instead of saying Clinical Commissioning Groups every time, I'm going to say CCG, just as a shortened version. Then we've got Ros Hartley, who's Executive Director, Strategy and Transformation for the Hampshire and Isle of Wight Partnership of CCGs. Then we welcome Jenny Irwin, who's Director of Mental Health, Transformation and Delivery for the Hampshire and Isle of Wight Partnership of CCGs. And we're hoping joining us will be Simon Bryant, who's Director of Public Health for Hampshire County Council and for the Isle of Wight Council. And I don't know if you saw him like I did. He was on television earlier this week on South Today. So he's now joining us. Then what will happen, each panel member will do a little introduction and they'll set the scene. And the big thing for today is the Q&A. So the Q&A questions will then start. Then the Q&A webinar, after probably about half an hour or so, as we approach 3 o'clock, will end. I'll confirm the date and the theme of the next Hampshire and Isle of Wight Social Prescribing Network webinar. And there'll be an opportunity, if you wanted to say something or pass a comment on, for networking via the chat for anyone who wants to stay beyond 3 o'clock. So firstly, to introduce myself, I know quite a few of the faces that I've already seen register, but some of you I don't know. So my name's Angela Gill. I'm the facilitator today. I program manage and facilitate the Hampshire and Isle of Wight Social Prescribing Network meetings, and at the moment it's webinars on behalf of Community First and Gosport Voluntary Action, or GVA for short. I also am a GVA project manager for the Surgery Signposting Project. I work with Citizens Advice Hampshire on the Home and Well project, and I work with the South East Hants, Fareham and Gosport CCG, supporting in some respects monthly facilitated meetings for the NHS England social prescribers. And I'm really pleased to see a few of you here today, so that's great. So welcome to our regulars, lots of regulars joining us today. I think our membership for the network is almost up to 200, which is amazing, but particularly welcome to those who are joining us for the first time. Now, if you had an email from Lynn, you'll know already that this webinar is being recorded. So just to make you aware of that. And the PowerPoint, this PowerPoint that we're covering today, will be circulated. Now, if you've joined and you haven't previously linked up with Lynn Dudman, I'll explain where the chat facility is, but we'll need you to put your details down if you want to receive an email with the PowerPoint on, and that will be in the chat facility. Some of the panelists have brought with them a few slides, which I'm going to manage for them. And I noticed some of the text is a little bit small. It's more like an aide memoir. So please don't worry if you can't see the detail, because the PowerPoint will be circulated next week by Lynn Dudman. So can I start by asking anybody who hasn't, please to mute your microphone and your camera, unless you're going to be asking a question. And obviously, at that point, please turn your camera and microphone on. If you don't know how to do that, I'll just explain. If you hover your cursor towards the bottom of your screen, you will see a little menu bar which will pop up. And it's got a few options around the camera and your microphone. And you can also do Control D if you want to turn your microphone on or off. So that's your sort of menu bar. And then if you look at the top right-hand corner, you should have a little bubble, and that bubble is your chat box. So if you click on that little white speech bubble, really, it will open up the chat box. And at the bottom of the chat box, if you want to submit a question or put your email address or make a comment or share some ideas, please type it at the bottom and then press return, and that will note your message or your question. As I said, when I am ready, I'll go down the chat list and I will invite you to speak, and I'll try and do it logically. And I can see that we've already had an advanced question from Dr. Gordon Brooks, so I will be starting with Gordon. If you're joining us by phone, like Brenda, for example, I can't ask you to type in the chat box. So when we move to the question section, I'll need you to alert me verbally if you would like to ask a question at some point. So that's the only way I will know that you're waiting to ask a question. As I said, there's an opportunity to network via chat at the end, and we really welcome feedback and your ideas. The webinar will also be available via the Community First and Gosport Voluntary Action websites by next Tuesday. That's the 21st of July. So please let colleagues and service users know. So what I'm going to do now is hand over to Tim Horton, please.
Thank you very much, Angela, and good afternoon, everybody. It's really good to be seeing so many people and having yet another further conversation about how we can improve services, and particularly in relation to health and wellbeing. So I'm the Chief Executive Community First, and Community First's role in regard to health and wellbeing has really been to work in partnership with clinical commissioning groups, with NHS providers and with primary care, to deliver a range of support on behalf of and in partnership with the wider voluntary sector. Our role through the COVID crisis has been embedded within the local resilience forum, principally through some of the subgroups looking at welfare and supporting the most vulnerable people in our communities. And in order to do that, we've been linking vulnerable people with local groups that can help them with particularly things like shopping and prescription collections. We've been recruiting and mobilising an army of volunteers and giving all of that support and essential advice to the voluntary sector groups that have needed it in order to provide the support they've done safely and successfully. I really want to talk very briefly, because it's all about you asking us and the wider panel. I'd firstly like to just say thank you to everybody that's been involved in supporting vulnerable communities and individuals. I know how many people around the table there are from the voluntary sector, and indeed from our partner organisations in the NHS and the CCGs, and of course Hampshire County Council, who have been at the heart of providing that support. I think what it's highlighted for me is that it's exposed quite a lot of underlying vulnerabilities in our communities, and quite a significant proportion of people just about managing. And it took something like COVID to tip that over the balance to mean that they were dependent on much wider support from volunteers. So we have many people with fragile social networks, with reliance on one or two individuals to help them in their day-to-day lives. And I think that's something that as we go forward, not just in our own voluntary sector, but in the wider sectors across statutory organisations, health and wellbeing, and indeed in local authorities, we need to work together to devise new solutions to tackle that problem of those that are just about managing but were not known to or being actively supported by statutory services. I know that the crisis isn't over. There is a significant lag. We're going to see more people needing more support going forward. The shift now is much more towards mental health, and I'm delighted that Jenny's going to talk a little bit about some of the work that we're doing in the CCG around mental health, as well as hearing from Tim, Roz and Simon on their key agendas and priorities. But that certainly is a key priority for the voluntary sector, and there may be a number of questions and thoughts that people have. For me, the last thing I'd just say by way of introduction is that for me going forward, it's all about putting the beneficiary first, all about putting our clients, our patients, the people that we're trying to help first, in order to provide that effective support to lessen their vulnerability and help to rebuild and re-establish some resilience, rather than looking at it from an organisational point of view. And I think from the conversations that I've been having with our NHS colleagues, both on the commissioning side, but also on the provider side, that's very much the thinking and approach from themselves as well. So how can we challenge and change what we do to build back better and deliver better services for those people that were just about managing through before COVID and are going to struggle significantly afterwards. Thank you all.
Okay, thank you very much. So I'm going to now hand over to Tim Cooling, please.
Hello everyone, hopefully you can all hear me. Thank you, Angela, as well. I live in fear for your battle. that can cut in at any moment, so we'll try and be brief. We're just going to talk a bit today, obviously, about Hampshire's changing health structures. So I thought I would just spend a small amount of time just putting all of that into some context about where we are at the moment. So from an NHS point of view, there was a really important document that came out last year called the NHS Long-Term Plan. And it covered a whole number of areas, including things like how we tackle health inequality, some of the stuff that Tim's touched on already, digital innovation. But one of the big headline messages was they were asking people to move into what's called integrated care systems, covering sort of populations of people and looking at population health. So as we stand, about half of England is covered by integrated care systems already. And we're working towards doing the same in Hampshire and the Isle of Wight. So the slide that hopefully you can all see is just some of the building blocks about what an integrated care system might look like and contain. So one of the big things at the moment that primary care have been working on is developing primary care networks. And we have about 42 in Hampshire and the Isle of Wight, and they are sort of groups of practices coming together to serve a population of people of about sort of 45,000 people. They do vary. Some are bigger, some are smaller. And they're the real building blocks of the healthcare system at the moment. And they're working through their maturity. The other part of it is delivering things on a health and wellbeing kind of footprint. So working with our local authority colleagues, health and wellbeing boards are really important. And I enjoy being in that space, working with our adult social care colleagues, the voluntary sector, many of whom have a seat round health and wellbeing boards at either Unitary or at Hampshire. And then lastly, we've got what we call integrated care partnerships, which are footprints around acute hospital trusts, working with our hospitals to deliver all the things that you can see on that slide. And people like Jenny will elaborate more around things like mental health and on the community aspects of that. But they're really key sort of partners for us in trying to deliver some of this care in our community. So there's a number of different footprints that people are working on, but really the headline message at the very top of that slide is people working together in a more efficient way, trying to redesign things at scale, but keeping stuff local where appropriate as well. So from a point of view, we're being asked to become sort of leaner organisations. A number of the CCGs in the Hampshire and Isle of Wight footprint will be looking to work more closely together over the coming year and hopefully work towards becoming an integrated care system early 2021. There's all sorts of benefits towards that around us perhaps getting more financial autonomy, more support into integrating our care. And just really to lastly picking up on the opportunity that it brings to do all the stuff that Tim's alluded to, the voluntary sector partners particularly, making that whole part of the sector a lot more sustainable. So that's all I wanted to say about sort of setting the context, because I know Ros and Jenny will want to talk a bit more in detail about what's going on in some of the community and mental health aspects.
Thank you very much indeed, Tim. And I'm now going to hand over to Ros Hartley.
Thank you. I won't say my title because it's way too long, and as I see it, I'm just one of many people trying to do the right thing with others in the system, and that's, I think, really, really important rather than get hung up on our titles. So just really, really quickly, and I have got a few slides, but I'm not going to go through them in any detail at all. I think as Tim has sort of said, before COVID, we had a plan about what we were going to do. COVID came along and we changed some of those plans, and we actually fast-tracked some of those plans, and we changed some of those plans. So COVID has been awful for everybody, the whole country, and loads of people more than others. However, it has taught us to work differently, and as Tim said right at the beginning, we probably have realised our vulnerable population in a way that we haven't done before. So the next bit for us, I think, I'll whiz through these slides, is I think the key thing for us is to decide what we want to keep from COVID, some of the way that we have worked and the way we want to continue, and some of the things we don't want to continue, some of the things that we don't want to carry on, because there are some really great stuff in terms of working with the voluntary sector. I've been working with Tim really closely on some of the things that how we really step up services to protect people out of hospital in a different way. So just on the recovery principles, really quickly, you can read these, but these are some of the things that we must focus on now going forward. How we keep people safe, how we make sure we've got the right outcomes. There's a really fun word, subsidiarity. And for me, that's how do we make the decisions for people, for patients, for residents as close to where they are and where they live as possible, and get services to support them as close to them as possible. So it's just really how do we do that? Linking in with what Tim said in the last presentation, we work at different levels depending on what the issue is. Just going to quickly whiz forward to the next slide. So these are some of our plans going forward, which again, I'm not going to really focus on, apart from obviously money is important and we've got to be clinically sustainable. We need to strengthen our primary community and mental health offer for precisely some of the reasons that we've already talked about. We have got, and we realise now we've got a vulnerable group of people. We do know we have to focus and make sure our hospitals are safe. And the last one is, there are sometimes times where we have to work at scale. We'll work locally wherever possible, but there are some things that we can really do better together. We can share ideas, do it once, make sure that somebody in Portsmouth has the same service as somebody in Andover, and so we need to make sure the outcomes are the same. Just one really quick example we're working on, which I just really wanted to, and we don't need to even go on to the next slide because I can just, but you'll have all heard of Nightingale hospitals for the acute sector. We're also looking at something called Seacole centres or Seacole services, which is also named after a nurse called Mary Seacole from the 1850s, who had an innovative way of treating people in the community. And one of the things we'd really like to do is how we can get better community services locally. And that might be with our local authorities, with our voluntary sector, with people out of hospital in a different way than we've ever worked before. And we've got an opportunity like we've never had before to do a different model. So I'm just going to leave it like that. So for me, it's working together, working differently, and using some of the things we've learned over the last few months through COVID. Thank you.
Thank you very much. And I'd now like to hand over to Jenny Owen, please.
Yeah, thank you very much. There's just a couple of things in the context of the conversation that we've been having that I wanted to pick out of the slides, really. I wasn't proposing to go through all of them, but I think the main one that would be useful to flick onto, please, Angela, is the one with the 5 blue segments on it. So if you keep going through, and again, here we go. So there's two things for me, really. The first is to say that, you know, COVID is a major incident, level 4, NHS level 4 major incident, but it's also a significant event for entire communities. And the NHS is not the sole responder to COVID-19 and everything that's happened for people who live in places. And I think that's really important because it can be seen very much as an NHS response to a health crisis, which it is for us, but it's also about community recovery. And there's a really beautiful document by the Centre for Mental Health, actually, which looks at communities and the trauma that communities have experienced through COVID-19. And I think that's a really important framework because that reaches everything from how faith groups within communities can resurrect their ways of being, right through to pockets of economic deprivation, how we reach Black and ethnic minorities communities differently, what different support needs we need to put in, and really does talk to the need to look at the trauma that communities have experienced as a result of COVID, rather than just the individual nature of what we do. But my role essentially as the Director of Mental Health Transformation and Delivery is to focus in on where mental health service transformation can support in the context of that. So I think there's a big chunk of work which is about working with whole communities across the general population. And what we've done in looking at the impact of COVID and where we need to focus our energy as the NHS, some of that will be about directly delivering things differently or putting new things in place, and some of that energy will be very much about working with partners across every aspect and every area you can imagine. So I think in terms of looking at the whole general population, there will be a new clinical presentation which will be quite low level. We've seen it from previous pandemics, and we can see it already with COVID-19. Social anxieties, people feeling lonely, isolated, those sorts of things that primary care will start to have quite a significant touch point with. But no doubt, so will the voluntary sector and other organisations. And the last thing we want to do is to medicalise our response to that and make sure that people who live in local communities get the services that they need and the support they need, which is not necessarily NHS directed. There's a whole piece of work to be done with local communities, supporting businesses, etc. The second area of focus for us is to look at people who are currently experiencing secondary care mental health services because they're quite unwell. And we've seen, you can have a look at your leisure through the other slides that I've put in there, but those really do talk to the fact that we've seen people amongst all services, but specifically for me, my focus is mental health, not coming forward for services or really pulling away due to fear of COVID or for whatever reason, not being able to access services. So we do have significant amount of catch up to do to really make sure that our services can meet not just the sort of latent demand from people not being able to access services or not being willing to access services, or particularly where digital innovations have been put in place of face-to-face, but we do know in mental health that that's not always appropriate. Digital innovation is great, but it doesn't always neatly replace a one-to-one or group piece of work event that people need. So there's an awful lot of work to be done in that space. We're also now looking at some new specific components. The COVID survivors in particular may not be something we need to focus on in terms of a huge piece of work locally. We're certainly connecting with regional and national colleagues. You can imagine that the traumatic experience of going into hospital, having experienced 2, 3, 4 weeks plus of ventilated care, etc. So there is a specific cohort of people that will need a psychological response from us, which we're working on. And again, alongside that, people working on the front line in delivering services, COVID services, and supporting people to deliver COVID services has been a real challenge for us. And we do need to make sure that we can respond to all of our frontline workers, not just those that have lived and breathed caring for patients for 24 hours plus in one go, wearing full PPE, because that in itself is a traumatic experience. But for example, we've had fire officers who've retrained to drive ambulances, who've been setting up temporary mortuary spaces, all of the sorts of things that are very much not normal for people in their lives, and we need to recognise that will have quite a unique impact on people very differently. The tranche there around the bereaved is extremely important. We can expect, and we know through our academic partner work, that we can expect a particularly difficult bereavement response and reaction from certain people and their families. Nearly 45,000 people have died in the UK from COVID, and for many of those people, they've not seen their family members before they died, and actually funerals have not been able to take place, and where certain cultural practices have not been able to take place, that's been very difficult on a very specific cultural level for people as well. So there will be a particular grief reaction that we need to provide a clinical service to. And then last and not least is our children and young people. So we know that in Hampshire, the CAMS service for people who needed a detailed and probably NHS-led response have not quite got the service that they need, and we do already have quite long waiting lists. We know that children and young people have not been in school for quite some time. There's no doubt a number of children that will need something new. We won't really understand that fully until September, until children come back into school, but we already know that safeguarding referrals are rising, and that children and young people will certainly need us to respond in full to that. So we're working very hard to make sure that's in place as well. So that's kind of a broad summary of all of the things that the NHS is doing to either support partners or respond directly to the work we're doing. And alongside that, there's a whole world of transformation programs that we're delivering, and I've tried to kind of summarize these in one slide really to kind of show the core functions and the places where we're working. So I'll leave it there so that we've got plenty of time for Q&A, but I hope that was helpful.
Thank you very much, Jenny. And I'd now like to hand over. I didn't know if Simon's here. Is Simon here?
I am, yes.
Excellent. I'd like to hand over to you then, please, Simon.
Many thanks. I'm afraid I don't have slides that I managed to send through. I wanted to talk about a couple of things. And one is, there's been a pandemic, and it's been an extreme health event and a public health event. And as you've heard from other speakers, it has affected the health of the population and also the way we delivered health services. And I'm really keen that as you listen to other speakers, we work together to kind of get services and health back up for our population. I think the thing I would like to share is something you've probably heard in the news. I'm leading the local outbreak control plan for Hampshire County Council and for the Isle of Wight Council. There's two plans, and there'll be two for the cities. And that plan is to really look at how we manage the pandemic on a local level, ensuring that we can mitigate and prevent any spread of infection as best we can, and then react and support any outbreaks or incidents that we need to. You'll be well aware of the issue in the Gosport pub over the weekend. I think it became news because it was the first weekend we'd had kind of pubs open and we had to deal with something. So those are the kind of things I'm dealing with on a shouldn't need to arise on a daily basis. We're reviewing that, and I'm leading that, and I'm really pleased we're leading that locally. Loads of work going on, and the plan focusing on a number of areas. I'll quickly go through those. The first one is care homes, and there's a very strong programme with partners around the table and others led by direct startup services. The second area is schools. As schools open up further, we need to ensure we can support schools to prevent spread of infection. You'll have heard of the bubbles, and if you've got children at school, you'll know that they're in a bubble. And then what we do if there is a case in that bubble or suspected case, which is key. We can support that, and we're looking at that and how we prepare for September as these bubbles get bigger. The third area is hugely complicated, and it's called high-risk settings communities. So where do we think that there may be more likely to be an outbreak, or the impact could be more challenging? So we're working on a number of high-risk settings, and they range from meat packing plants, faith settings, transport hubs, custodial settings, all these different places where actually managing an outbreak is incredibly difficult. And we're working across all our authorities to ensure we identify those, prevent as much as possible, and then further reduce any impact of outbreaks. And quickly, the other areas are testing, which we've heard a lot about. I now have much more oversight and control of the testing locally to make sure we can get everything tested who needs it, and tracing, the contact tracing, the process of following up people who have been identified as positive and those who need to self-isolate because they're a contact of a positive. Underpinning this is all the data, and data is now coming through in a much more robust way, and I'm getting that on a daily basis, and that's really, really positive. And just to say, Leicester didn't have the information that I now have for my patch. The next area is making sure, as I've heard others say, the vulnerable people. Obviously, if someone needs to self-isolate and they're vulnerable, we are working through the processes that we have had previously for shielding populations to make sure people are supported. And finally is the governance arrangements, really important. So there is a health protection board, which I chair with relevant people around the table to manage any infections. So looking at some of the data. And then there's a local outbreak engagement board, and each area that's chaired by the leader of the council and is the kind of front-facing board for that. So I will stop there, but my final message is really, please don't forget social distancing, hand washing. Still, we're in the middle of a pandemic. We're working well, but actually those messages are really key. So let's keep getting those out to the people we're working with and connecting with. But 2 meters, please, and good hand hygiene is really fantastic. And get tested if you're unwell. I will pause there, and I'm sure more time for questions.
Thank you very much, Simon. Okay, this is the bit where the audience, I hope, have been waiting for. So I'm going to start at the top of the chat with Gordon. Now, what I'm going to ask each individual to do, if that's okay, is when I ask you to ask your question, if you could just explain if you're representing an organisation, and if you could give your name. So the first one I've got is Dr. Gordon Brooks. So if you could start with your first question, Gordon, please.
Okay, are you hearing me, first of all?
Yeah.
Yeah. I've just washed my hands, just come back. Okay. I'm work with GVA. I'm a volunteer signposter. Prior to all that, I was a medical doctor, PhD medical informatics, Falklands veteran, and had experience with Veterans Health at Portsmouth, Voss, and many years exciting work in charge of knowledge and decision support at a major GP computing company, of which there are many. But before COVID, I was concentrating on electronic data collection, case analysis, and evaluation, and tools for connecting our social prescribers with support services to cater for particular needs of the clients. Now, my question then, so I'm more of a, I like to see what the nuts and bolts are and how it all works, really. What local plans are being made to efficiently bring NHS and volunteer social prescribers to bear in a coordinated way on the expected post-COVID surge in socio-medical problems brought about through job losses, consequences of bereavement, PTSD, other mental health issues, deprivation, delayed treatment, chronic family problems, housing issues, and other pressing needs? Thank you. That's it.
That's a full question. So who would like to kick off with a spark to a response? Tim? Okay. Either Tim.
Tim, you can take your pick.
I mean, I was going to suggest looking at the previous webinar as well. I was going to plug that for you, Angela.
Yeah, and it's still available on Community First and Gosport Voluntary Action's websites.
So there we go. I've done it. So, yeah, and we talked a lot in there, didn't we, about the importance of social prescribers in primary care in terms of picking up some of this mental health work that we know is going to come down the line. And Angela, I know that you've been working to implement some additional training along those lines for social prescribers. So we absolutely hear that. Certainly, Gordon. Tim, do you want to come in?
Well, I think just to try and give an illustration, Gordon, because I think you've hit a nail on the head, one of many nails, but a key nail on the head about how we better coordinate between the voluntary sector and social prescribing and primary care and NHS services. In Southeast Hampshire, I know there are discussions taking place around a one-team approach of coordination, which the voluntary sector and myself are already plugged into. It's very early days of conversations around this as to how we come back to that model of putting the patient at the centre and building the support networks around that. Now, there will be a number of different solutions in different geographies, but that will enable the voluntary sector to play a key role rather than feeling as though we're just a secondary solution and where problems can't be solved by NHS, but we're actually at the forefront of taking more referrals through, building the capacity of social prescribing solutions. And that's not just obviously the signposting work you do and colleagues do in Gosport is a wonderful example of referring people into a myriad of voluntary sector support. One of the things we're going to have to be mindful of, and we're already starting conversations about, is the capacity of the sector to re-establish and rebuild itself, because of course a lot of activities that social prescribers would have referred into have ceased during COVID and need to be re-energised and remobilised, and often funding and resources is part of that problem as well as some of the practicalities. But I do think the short answer is there are steps being taken. We need to replicate that scale and look at how we can do those solutions locally. The one team approach is certainly something that's happening in other parts of the county. I know that we're talking about specific services around mental health and wellbeing. So in East Hampshire, for example, there's a partnership, again involving primary care, again involving the local authorities, again involving the voluntary sector, particularly in this case looking at young people's mental health and wellbeing, what the needs are post-COVID and what can be brought back to support those young people's mental health needs. And what we will do is build an evidence base that we can then also reach out and attract further funding from the voluntary sector to deliver services over an extended period of time.
Thank you. Okay, would any of the other panel members like to chip in? Or Gordon, is there anything else you'd like to say? Does that?
No, I just want to think around the area, really. Of course, my knowledge is all about connecting up different sorts of people electronically and you know, monitoring it from behind. But let me just stop on that theme and allow you to have some other questions, because time's moving on.
Okay, thank you very much indeed. So second person is Annabelle Cook. Annabelle, would you like to ask your question, please? Deadly silence. I'm hoping Annabelle is taking her mic off. Okay, I can't hear Annabelle, so I'm going to ask the question for her. So the question is, what role does the panel see arts and creativity playing in the recovery of young people, particularly in terms on mental health, and how do we take that forward? Oh, Annabelle's just saying her mic's not working. So what do we see as the arts and creativity playing, the role that they play in the recovery of young people, particularly in terms of mental health, and how do we take that forward? Who would like to start with that?
Would you like me to kick that off? So
okay, yes, please.
Yeah, I think a crucial role, actually. I think a lot of our children and young people use art and creativity as an expression in normal life, actually, as opposed to in times of illness. So I think it's hugely important, and also should be built into our approach within schools as well, in terms of the mental health in schools programs, and how we make sure that becomes part of the sort of normal fabric, really. I think we've probably got some exploration to do with partner organisations to make sure that really does come through, and I think it's actually a really helpful question, and I'd quite like to, if I can put my email address in the chat box there, it'd be really useful to explore that further, because I think we're in the process really of expanding the children's services, but actually an intervention like this would come way before somebody would be in need of, you know, of a kind of a secondary level children adolescent mental health service. So we want to keep this very much in the wellness space as opposed to the illness space, I would say. So yeah, I'd be really keen to explore that further.
That would be really good. And also, everybody's email for the panel members is going to be circulated because it's on the PowerPoint. So don't worry if it doesn't appear in the chat. Everybody will have access to the panel members' emails. Thank you.
Can I?
Okay. Jenny, is there any other panel member?
Oh, yeah. Yeah. Can I just add something? It's Roz.
Please, Roz. Yeah.
I love those sort of questions, because it makes me realise, you know, we are in post and we're paid to do a job and we don't know everything, you know. So it's, for me, it's how we work with people who know far more about some of those things than we do. So I would like us to get into a space, because that's what I think some of the learning from COVID has been. We've used the different resources, different experience of people that we haven't done as much as we should, I don't think, in the past. So for me, it's great question. And I love Jenny's response going through, you know, how do we get those for first? So for me, it's how do we get people who've got a view on that and have got more knowledge than ours on what works and what doesn't for young people, and the role of arts and creativity in that. So for me, it's how we do that going forward, get the right people in the room to help us get the right solution.
Brilliant. Okay. Is that okay from the panel? Then move on to the next. Yeah. Okay, the next question is from Kate. So Kate, I don't know your second name. If you'd like to unmic and introduce yourself and ask your question.
Hi, I can't see myself, but you can probably see me. So my name's Kate Drake. I'm Health and Wellbeing from South Downs National Park. And my question is about green spaces and the use of South Downs National Park, and how you would see post-COVID recovery how you would see the usage of green spaces and South Downs National Park to aid people's recovery, because as we're aware, during COVID, we've had an influx of visitors to the park and to green open spaces, which has been fantastic. So it's how do we capture that and continue to use that as a way of improving people's health and well-being. Thank you.
Okay, who would like to start?
Shall I just come in with a quick contribution, Kate? Because one of the things I know that from one of the services that Community First and other voluntary sector organisations play things around healthy walks, and it's been one of the services that's been most in demand to bring back as quickly as we can, because just the sheer volume of people that enjoy green space, want to get outdoors. We know that there are some, physical consequences as well as psychological consequences of lockdown, of people not seeing friends and family and not having that social interaction. So for exercise, but the Healthy Walks programme was going from strength to strength pre-COVID and is definitely going to come back. Just encouraging people to access spaces safely, to do it respecting the requirements to maintain distancing, but just to encourage people to visit and explore is going to be fantastic for people's physical and mental health and well-being. And there are many more. One of the roles we're looking at for volunteers going forward, after people have exhausted themselves with shopping and prescription deliveries, is to ask them to look at, would they become more walk leaders? So could we work with national parks, both yourselves at the South Downs and of course over in the Forest and New Forest as well, to create bigger programs around healthy walks, around recruiting more volunteers into walk leaders who could encourage more people to use and access and explore those spaces safely, and try and also work with you to avoid honeypot sites and places where people will concentrate and always go to, and then you might end up with problems around social distancing in the interim. We also were really keen to do some work, and we have done, I know, with yourselves at the South Downs, around making sure there's good access for people with different abilities and disabilities, and perhaps a cohort of our population who would be less likely to travel into the Downs, particularly again from some of our more urban areas, and just to help them to explore it safely, or to have the mobility and the opportunity to do that despite their level of ability or disability.
Super, thank you. Okay, would any of my other colleagues like to chip in? Tim?
Yeah, I was just going to sort of echo that and also say, one of the things that has been positive about COVID is seeing how people have reached into things like cycling and walking in a way perhaps they weren't before, because if they were naturally gym bunnies and that hasn't been available to them, they've then had to go and find another way. And so I think there has been a sense of people exploring new things. And even for myself in the last sort of few months, there are a whole new set of spaces around where I live that I actually didn't even know existed, some wild swimming and all this kind of stuff. So I think falling in love with the outdoors again is kind of is happening all over the place. But I suppose it does lead on to the question about making sure we've got the right infrastructure, as Tim was alluding to, and being really serious about promoting cycling and accessible spaces for all. So I was just going to add that.
Okay, thank you. Jenny, did you put your hand up, or did you just... I wasn't sure if were you asking Jenny? No, you... Okay, that's fine. Super. Okay, if we move on, I can't see the question, but I think Ian Reed said to me he's got a question. Ian, are you still with us?
Yeah, hi Angela.
Would you like to ask your question, Ian?
Yeah, I think there's been lots of references by, I think, all of the speakers so far to local responses, subsidiarity, communities, and talk of involving the voluntary sector. And if there is a second wave of COVID in the autumn, like many people fear there may be, and given that the government's response seems to be orienting towards doing more things locally, like local lockdowns and stuff, what do you think should be done better next time if there is a second wave, particularly in terms of rapidly supporting families who have been put into lockdown? And what will be the plan to communicate to the voluntary sector in those localities and neighbourhoods to be informed where the lockdowns are implemented and who's affected, so that we can react and mobilise local resource more rapidly.
Thank you. Okay, Jenny, do you want to start?
Yeah, I mean, that probably is something with a different hat on that I can talk to a little bit, because in the other half of my job, I'm also the accountable officer for emergency planning for West Hampshire CCG and the partnership. And so between myself and Peter Horn, we've been leading the NHS's component of the major incident response. And so I'm quite well connected to the local resilience forum, which is where the entirety of the response is managed, as is Simon. But I guess what I would say about that is, my experience through wave one was that we rapidly moved from very, very informal volunteering, which was pretty much at a street level, where people just made a decision to help each other because they could see that help was needed, to something slightly more coordinated in terms of response. And there is actually a volunteer cell which is led by local authority colleagues, which feeds into that major incident response team, so that everybody knows and can communicate with the voluntary sector. And it does mean that the voluntary sector doesn't get pulled in lots of different directions and is quite focused on the core priorities. But those are very much in sort of responding to major incident terms. And I think there's definitely something about how do we reverse engineer that a little bit, so we really understand the intelligence that the voluntary sector already has, rather than leave people sort of the passive recipients of tasks that need to be completed on behalf of. I think that the important point for me there is actually there's lots of intelligence in communities already. People already know who's vulnerable, who needs extra things, what the gaps are and things like that. So I think we should try to capitalise on that already, rather than wait for wave two to expose those gaps further. The only other thing I'd say is that I was listening to a lecture by one of our, oh gosh, I've forgotten his name now, one of our professors who's very much involved in suicide at a national level. And he was talking about COVID-19 kind of running through the fault lines in society. And I think the more that we see the impact of COVID, the more that we'll see disadvantaged communities and local places where the impact is worse for certain components of society. And I don't know if Simon's got a view about that, but certainly I think linking that knowledge to the power that our voluntary sector can add in a proactive way is great.
Yeah. Pick up there. I think it's really important that we, as we try to prevent and support communities, we are identifying those that are more vulnerable from COVID, and working with you as a great asset. And as Jenny said, knows the community really well, and we're doing that work. We're kind of really starting that work to make sure people are supported. To kind of take the preventive measures now, actually, are they thinking about their health and well-being now, so that they can prepare and not be so affected by COVID should a second wave come in the autumn. I think your question about lockdown, it is really, really difficult. If we are moving in that direction, we'll be moving quite fast and at pace, but we will be making sure we communicate with the right agencies, so that actually, if we get to that point, and I really hope we don't, we are prepared for that, and we can work together, as Jenny said, through the LRF. We're well used to working together and through those structures, and we'll be doing that at that level to make sure that we can support communities. And we're doing a lot more before we get to a local lockdown.
Thank you. Okay, is that okay for the panel? Tim, did you want to?
Can I just add, and perhaps a sort of practical suggestion for in response to Ian's question? I think it's really important to look at what we could do better if we do have to do something like this again. I think one of the things that's really important in order to prepare for that is to have good intelligence around the voluntary sector in our local areas. So keeping volunteers warm, having a good understanding of those mutual aid and other groups that provided support in the first wave, of who is continuing, who is about to perhaps stop and hand over. And I think that's a really important role for the infrastructure organisations. So in your case, Ian, GVA, to be able to kind of keep a handle, so that there is a point of contact. The CVSs, the Councils of Voluntary Services in Hampshire, have been embedded within the local response centres to provide that coordinated role within the wider voluntary sector. And I see that as being a linchpin for successful rollout or remobilisation of voluntary sector offer and volunteer offer in a local area. But we need to have that intelligence, so we're not asking people who packed up 6 weeks ago and don't have any intention of being available to do anything again. And that's something that we can be planning for now and doing short surveys, doing them regularly in order to keep that information live and current.
Okay, thank you very much. Okay, Heather Massey, if I would like to invite you to say your comment. You've got a question there, please.
Hi, thank you very much for inviting me to this seminar. My name's Heather Massey. I'm from the University of Portsmouth. I work in quite close collaboration with a number of outdoor swimming coaches who are very keen to offer their support to improve the well-being and mental health of the local community. We're looking at ways to try to expand provision along the south coast, in effect. Other ways we can do this to support potential service users, and clearly these guys are all correctly trained, because it's quite a hazardous environment to go into, but we're wondering what the next step would be in order to promote their services.
Okay, who would like to start? Which panel members got ideas?
I suppose I'll come in just as a kick-off and see if others have contributions. But Heather, I think one of the things we're doing, and it perhaps won't be unique to what you've described, but is helping organisations and those that are able to offer activities to re-establish those activities safely. So offering guidance around risk assessments, appropriate procedures, almost a kind of helping to translate some of the government guidance that can sometimes feel a bit top down and a bit ubiquitous, and some of it needs a little bit of understanding as to what it means for your service. So again, organisations like Community First, like Gosport Voluntary Action, and those covering the other parts of the geography in Hampshire can offer that support and advice on a bespoke basis for organisations. So that might be one thing we could do practically to help to see what the steps are that need to be taken to get some of those activities back up and running. And also, again, just encouraging groups to understand what the demand is, where it's coming from. We've worked with a number of organisations just to be cautious about wanting to get back up and running too quickly, because although government guidance might say one thing and you're allowed to do something, doesn't mean that you'll be inundated with a whole army of people desperately wanting to do it. There's still a lot of anxiety, nervousness in our communities. My personal view is I think that's appropriate that there is, and that helps us to manage the sort of, people feeling like it's all over and we're all back to normal and sooner the better. Just that note of caution is probably a helpful and healthy thing to have in our society at the moment. But that doesn't mean we stop people doing things. We help people to do things safely, and help groups and organisations and those supporting things like swimming coaches to do that safely would fall into that remit. So happy to help, depending on your location, or signpost you to particular people who can help in the geography that you're operating in, Heather.
Thank you,
Lovely,
Tim.
thank you.
Is
Tim?
Is it Angela I would speak to directly, or?
You will have Tim Horton's email on the PowerPoint, so you can contact him direct.
Thank you.
Okay, Tim Cooling, did you want to say anything?
Oh, I was just going to reiterate the importance of the social prescribers again, and the value of the social prescribing network in terms of linking in and making sure that people are aware of your services out there. Increasingly we're just trying to encourage people who interface with primary care to take up these non-medicalised interventions, and that's what social prescribers are there to do. But of course they do need to know what's out there, and that's a constantly changing picture and a constantly changing landscape. So Tim and Angela and the network will help put your message out there and let social prescribers across Hampshire and the Isle of Wight know you're there.
Lovely, thank you. The next comment, Nick Ralph, if you would like, you've got 2 points there, Nick, so if you'd like to say your points.
I think Nick has left the meeting.
Oh, has he left? Okay, in which case, don't worry, I'll say what Nick said then. He says, and there is the voluntary sector working group of the LRF, of which Tim Horton and Nick they're members of. And he's also got a comment saying better collaboration from the RVS over the NHS volunteers would be good with the voluntary sector. So is there any observations or comments any of the panel would like to make on those 2 comments from Nick Ralph, please?
I think we agree, Angela. I certainly would agree with Nick's observations. The voluntary sector working group and the voluntary sector cell is playing a key role and will act as an important conduit for comms and communications going forward. And yes, to the better collaboration. I think again it was Ian's point about that local, I think, has been more productive. There are significant numbers of volunteers. And as of next week, we'll have the report from the volunteer survey that was conducted in partnership with Hampshire County Council and the University of Winchester on a county-wide basis, that we know that around 40% of local volunteers, or slightly more than 40%, want to continue volunteering post-COVID. So the more that we can do locally, the better, really. And that's the message that I think local voluntary sector organisations are giving out. We can use the NHS scheme when it's appropriate and where we can't do it locally, but the first port of call, I think, should be local.
Brilliant, thank you.
I think I would agree, and I think Ros and I will remember well desperately trying to work out where the connection to the National NHS Volunteer Service and the local army that we already had kind of became one, and I'm not sure they ever quite did, to be perfectly honest. But I think local is definitely better and absolutely should be our starting point. And I agree. I think there's learning from there that we need to build up from local communities into something that we see at a high level rather than start at the top and then filter things down.
Thank you.
And I guess I just say, I guess for me that is the message from me today. Really, is about how we know local is key, isn't it? We've got to keep people well, our vulnerable people, patients, residents, by providing services locally wherever possible. Of course, there are times when we collaborate wider, but local really has shown to work through the last few months. So I think really hold on to that.
Super. Thank you very much indeed. So I'm aware of time, so I'm going to put a stop to the questions. I'm really sorry if you had a question, but don't forget what I said. The PowerPoint will have everybody's from the panel email address on there. I just need to say a big thank you to the Q&A webinar panel, particularly people who have put time and thought into what they're going to say and or produced a PowerPoint. Particularly to Lynn, who's done a practice run with me and set up technically, which is great. And all the participants and the people who asked the questions, and hopefully the people who listened to those debates and discussions. Please feedback by chat or to Lynn via email direct, including any future social prescribing webinar theme ideas. As I say, apologies if you didn't get a chance to do your question, but please ask direct. Do email Lynn any relevant social prescribing items to share by Friday the 7th of August for inclusion in the Hants and Isle of Wight Social Prescribing Network newsletter. And the webinar, as I mentioned, will be available on Community First and Gosport Voluntary Action's websites by the 21st of July. So just future dates, really. The next webinar will be between 1 and 2:30. The theme is social isolation, and it's on Tuesday, the 8th of September. And I'm going to take some ideas from yourselves before we set the theme for the next, which will be the 1st of December. So plenty of time. If you've got a really good idea, a theme, something topical that you think would be really good as a webinar, please either put your ideas in the chat or email Lynn Dudman direct. The newsletter will be coming next month. Thank you very much for joining us. Please, if you want to still have a little chat with anybody, and it's good that there's been some networking already going on, please feel free to drop a message into the chat. And the 2 contact email addresses for the websites for Community First and GVA are there, and as is Lynn Dudman's email address as well. So thank you very much indeed. Feel free if you want to put any other messages in, but the webinar is now finished. Thank you.
Thank you very much, Angela. Thanks for facilitating it again for us, and thank you everybody for joining us. I'm personally quite happy to stay. If anybody has any further questions or wants to continue chatting online, then I'm happy to stay online for a short while, but I know others will have other commitments, but yeah.
Thank you. And we've got a message from Conroy. Hopefully Conroy will email direct. He did leave a question. So we'll hopefully, Conroy, you can pick that one up direct.
Mm. Yeah, I think it's a really important point that Conroy has raised, and thank you, Conroy, about, you know, the investment that needs to be made in the social prescribing activities and the voluntary sector, rather than just assuming it's going to be there for people to signpost and refer into, and particularly in regards to mental health, which is such an important element where it plays such a key role. But and you may well have further suggestions on how that's done, Conroy. I mean, it's you know, as you will know from your own long-standing experience, it's I think it's fair to say, and Tim and others from the CCG will back me up on this, that, you know, the CCG and not everybody in the NHS has all the answers. And sometimes, you know, the voluntary sector needs to kind of put forward proposals, needs to come up with potential solutions. I think there is an appetite for exploring new ways of providing those sorts of support and services. So, you know, there's probably a good opportunity now to, not to say that anybody's got in a sort of bottomless pit of money, but to start to test new solutions, to start to propose new solutions that might attract future investment, or, you know, would help to unlock grants, sponsorship, foundations, and others that may be looking to put in, you know, voluntary sector funding. Thank you. Tim Cooling, you also made a comment. Do you want to?
Yeah, and it's really just, I feel like I've said it 1,000 times. And of course, we had the webinar last time all around social prescribing.
I like this PR.
But it's great. It's great. And it's easy for us, actually, I think, to forget that the concept of social prescribing is still quite new for the NHS. And actually, there's part of the challenge is trying to change the culture within primary care about demedicalising some of the things that are presenting. And I think part of the challenge around, you know, excessive antidepressant prescribing, as an example that you've used, is it actually reflects the pressure that primary care are under in terms of the volume of people that are coming through their doors, and the number of issues that people are presenting with. And you know, I, for one, underestimate the value of having an asset like a social prescriber to be able to pick up on some of the social issues that are coming in through the front door of the GP practice. Because actually, in GPs that I've spoken to, you know, they'll say actually most of the things that they were dealing with that day weren't medical issues, they were social issues. And if only they had the place to send people to. But of course, a GP can't hold all of that information in their head about services that are out there. So the role of the social prescriber to be able to do all of that signposting, to be able to do some of the hand-holding, to support people more holistically, I think is really money well spent, and has to be the direction of travel, because we know primary care is a limited resource. We don't have GPs coming through. We need other professionals and people as part of a wider primary care team to support people in their communities. So yeah, I'm all for more social prescribing and to, you know, increase training for those people doing that really important work.
Conroy, would you like to make a comment?
Yeah, just you know, I'm pretty new to this forum, so it's really nice to be able to be included. You know, one of the most probably exciting adventures we've got going on at Forestry England at the moment is where we are creating a forest-based health and wellbeing centre at Alice Holt, the Forest Visitor Centre up near Fareham, where we're looking to sort of build a portfolio of health and wellbeing providers, whether that's sort of Nordic pole walking groups or forest bathing, or, you know, you name it, where people can be referred to from doctors through social prescribers, and you know, just you know, it's a great centre and resource there, and to be able to, you know, have that available to people would be great. So I'm just looking for partners who are already got these sort of activities and programs set up, so that you know, we can get them running at the centre, basically.
Yeah, and I just wonder whether it's worth having a conversation with people like Energize Me, you know, who are, you know, key partners within our local area, with a focus on physical activity, and putting in, you know, programs and creating some of those links. But equally, I know community first. and Angela will be happy, I'm sure, to have those conversations.
Yeah, definitely.
Yeah, absolutely, Conroy. Yeah,
Okay.
yeah.
Thank you.
If there's no more comments, that is it. Thank you very much for joining us. I hope you found it useful and interesting, and you're free to leave.
Thank you, Angela.
Thank you. Thank you, Tim.
Thanks, Angela. Nice to see you all. Yeah.
Thanks, Tim.